Hi, I'm Dr. O.
And I'm Dr. Amy.
We're both certified animal chiropractors. We're certified by the American Veterinary Chiropractic Association.
We're also veterinarians. We both went to veterinary school at accredited colleges.
And today, we're fortunate enough to be here in Wiley, Texas at Double B Equestrian Center. And we'd like to thank Rick and all the boarders that are gracious enough to let us work on their horses today. Hi, I'm Dr. O, and today we're going to look at a performance horse. This is a barrel racing horse we're going to look at today, but any performance, no matter what your discipline is, can benefit from chiropractic care. This guy ran 3 weeks ago. He's competing in the top level of open barrel races. Just not quite given the competition that his owner thinks he should be able to give her. And so we're going to take a look and see maybe if we can't find some chiropractic problems that we can correct and help this guy bring out the best in himself and his rider so that their performance is going to be better. And remember that these little things, when the horse moves, it takes every muscle, every ligament, every tendon, every joint, and every bone in their body to move. And so if we have a problem in one, it gets compounded. And if we don't take care of these, then eventually we'll end up with some problems like in the lower limbs. We'll end up with some problems maybe metabolically that are going to end up with maybe early retirement for this horse. So what we're going to do is we're going to take a look at this guy and introduce ourselves to him. And I just have a food treat here. And we're going to see how well he likes it. We're going to try to get him to eat off his shoulder. And remember, a horse is a prey animal, so they should be able to come around 360 degrees and get this treat. And as you can see, he's just not quite able to do that over here. He just can't quite get it. So let's turn him around, and we'll try the other side. Okay. So we have the same treat. And he just can't quite get this one either. So we know he's having some problems with his neck. Now, let's go around over here. Stay right, keep him right. And we'll take a look at his back. Okay? So, his back should bounce. And when I put pressure in top here, you can see that his belly bounces. Okay? When I come back here, which should be the most fluid area of his body, and I put pressure there, there is no bounce. His body doesn't bounce like it should. So we know he has a problem here with movement. And if I ask him to collect, what I'm going to do here, this is a reflex action. So when I get hit with a rubber mallet, my leg kicks. And it's automatic. It's not that it hurts. It's just a nervous system reflex. When I tickle him right here, he should collect. And he's trying. He's real uneasy, and he's not coming up very high. So that means that he's very inefficient in transferring energy from his back end, where the energy is generated in a horse, and it has to travel out the front end. And when this lack of movement in here makes that very inefficient. So even though he's been doing great, he's doing his job, he's performing on an everyday basis like he should be, he's got several problems that we can probably, hopefully, take care of with chiropractic care that will help him perform even better. So let's go adjust him, and we'll be back in just a minute.
Hi, I'm Dr. Amy, and we're here today with a mare who has been a barrel racing mare and took a few years off to have some babies. And so one of the things, the topic of the day, is why in the world would I spend time and money having my mare, who's a brood mare, get adjusted? And here's why. Lily's a really good example of an athletic mare who's put in her time running barrels and doing a good job and earning the right or the reason to become a brood mare and pass on her genetics. So what I want to be able to do with a brood mare is to pass on the right genetics, to pass on the best genetics, and not compromise my mare at the same time. Chiropractic is going to help this. It's going to help maintain normal metabolism. It's going to help maintain normal hormone function in this mare. It's going to help her to keep her body temperature up to normal. It's a little cold in here. I have cold hands today. These Back on Track gloves are really keeping my fingers warm. But if I'm having peripheral nerve function damage, my hands are going to be colder. My feet are going to be colder than the rest of my internal temperature. The same thing happens to these animals. When their metabolic level drops because of vitamin and mineral usage in building a foal, it takes calcium and magnesium and phosphorus to build bones. It takes proteins and amino acids and fatty acids to build muscle and nervous tissue in that foal. We want to make sure that she doesn't take it all out of her system, thin her bones, and deplete her own immune system in doing that. That's where chiropractic helps. It's going to keep nerve function going between the brain and the uterus, back and forth at a normal rate. If we do that, she's also going to have peripheral nerve function so that her feet stay in good shape, so that we don't end up with thrush, so that we don't end up with founder. Think of it this way. If I have cold hands and cold feet, which are the first symptoms we see in humans who have a low basal metabolic rate, those are also some of the first symptoms that we ignore in our horses, but there's some of the first symptoms we ignore a little bit in people who have progression toward problems like diabetes. Let's think about that for a second. Many humans and many mares who come off of having a baby come back a little bit hypothyroid. You've all heard of postpartum depression, and depression is a chemical change in the body because of hormone dysfunction. If we can keep this brain and spinal cord talking and working efficiently, we can decrease that dysfunction. When that happens, then we can actually get the whole system working better. We can make that peripheral nerve damage, which makes thrush and founder a possibility, become a less of a degree. We have these mares also having problems with things like crusty necks, pseudolactation, where they will actually produce fluid in their udder. It's not really and truly milk, but it's not good drainage for that udder, so they can become sore. They can actually develop mastitis when they don't even have a foal. The other thing it will do is help to improve and continue her reproductive system, keeping that uterus working like it should. There are smooth muscles in the uterine lining, and if it's not getting good nerve function from the head and neck and brain, then we are not getting good flow through the whole animal. How does this relate to her performance? If this end isn't functioning, that end can't be the motor. So we need to make those two talk to each other so that we keep her healthy and happy as a broodmare, but that also translates into returning her to work as the top performance mare that she is.